Hi everyone, we're at Giant Health today where we've had an exciting day with a lot of speakers teaching us a variety of different things in the healthcare sphere. We've talked about new technology, wearables, quite a lot of different things, but we really wanted to discuss our 5 top learnings from the day. So I kind of wanted to start talking about the Augmented Practitioners talk from Shafi Ahmed, which I thought was really, really interesting. So one of the things that he mentioned is that we are currently moving away from requiring the physical presence of healthcare professionals to be able to provide the best possible care to patients. And so he actually had a live demonstration on stage of using one of a particular software where they were connecting different specialists across the globe to be able to support one single surgeon at a specific, within a surgery in a specific location. So I think this is really interesting, and I think we are really truly moving towards this era of, combining and pooling the knowledge of all of the healthcare professionals in the world to provide the care for patients that might not otherwise have access to it. So, in the past, if you were, let's say, based in Italy in a remote place, you would only have access to the healthcare professionals available to you in that local area. But now we are able to pull in the expertise, not only just by sharing it online, but also bringing in technologies into the daily practice that can harness the potential and the knowledge of other clinicians and providing, the best possible care to our patients. So I don't know if there were any other things that you kind of thought that were interesting for today.
Yeah, something else that emerged from some of the speakers' talks were wearables. So wearables is a very hot topic. Everyone keeps mentioning it. How do you analyze all the data that you get from wearables, whether it's your Fitbit, any other wearables that you have inside the house? But as it's such a hot topic, will this continue? And something that was very interesting that came out of one of the interviews was Leon. Leon from Oxytone Medical said, yeah, I guess everyone's using it, but it's not really sustainable because you take off your Fitbit, it's something that can't really be monitored. Therefore, what's next? He said something that we should look out for is implants. So that's something that everyone's going to have, whether, if you're young or if you have a condition. That's something that can always be monitored and you can always analyze the data. So I thought that was very interesting. So moving away from wearables to implants.
Yeah, that's quite interesting. It actually picks up on another conversation we had talking about the use of technology in situations like big disasters or in remote locations. So what we're seeing a lot more is developing like small versions of some of the technologies that we're so used to using, like for example, an ultrascan or MRI, bringing those things into the locations where you can't provide that care for patients. So if you in the middle of a disaster and you really have to support the people that need your help immediately, you can't really wait and transport them to a larger hospital where you have all of these technologies available. So what we're creating now is like smaller portable devices. So in this specific situation, they were actually talking about an ultrascan that is probably the same size of your phone. It has a cable, you plug it into your smartphone. You don't necessarily need internet to be able to conduct a scan, but you can collect all the data and then upload it when you're back into a location with internet, and you can then share that information with other healthcare professionals. So this is really, really useful. And so it's bringing up this technology that can really be translated and utilized at its best wherever and whenever is required, which is quite interesting.
Yeah, that is very interesting. And I think something else that came up today, which I hadn't really realized, but it's also something that the speakers, exhibitors, I think tech companies are really coming onto, is that femitech. So most of the devices that are out there at the moment are really for men. They've been designed for white males. So something that they're moving on to is the other demographics, or the other 50% of the population, females. What's most interesting about it is because they're looking into females or the femitech, this also opens up many other doors, other demographics, having or looking at other genotypes, and also designing tech and devices around different populations, because you can't only have technology for white males.
Yeah. So that's interesting, because what we've seen as well today at Giant Health is that they've actually have a whole section dedicated to startups. And as you walk around, you see people of different ages, of different backgrounds, that have come up with these innovative ideas to really solve simple problems. So I know we've both kind of like walked across the floor, we've talked to a lot of people, and we've met a lot of interesting people and products. There are a couple of things that I thought were quite interesting. There was an app that allows you to basically identify like a small group of people that become like your emergency contacts. So for example, if you have an elderly relative that lives alone and you're concerned about leaving them alone, they can install this app that has a panic button that they can just press if they need anything, and it immediately alerts the people that they've nominated as their their emergency contacts. There was also another piece of equipment, like a bit of technology used to measure breathing, which is something that's quite hard to identify because you can only really see it by looking at someone. So it's something that's hard to measure. And so it's coming up with new solutions. Like in this situation, it was just a piece of paper. It's as small as a piece of paper that can really, you can really harness the data behind it and really start understanding more about these technologies.
Yeah, for sure. Something else I've seen is personalized healthcare. So some of the startups have really sort of engrossed in this area, and it's all about analyzing your own body, seeing what your genetics or can sort of predict for your health, or so really analyzing your blood and analyzing other samples to see perhaps you're more likely to get certain conditions in comparison to others. So I thought that was very interesting that they can give you data and analytics to support that. And that's something that's very good because it's preventative.
Yeah, so we're really moving towards like this personalized medicine, and we're kind of starting to see the first signs of having the technology being able to actually support that and what we want to see. Okay, sounds really good.
Yeah. No, I thought today was so interesting, and we're looking forward to coming here tomorrow. So stay tuned and also look out for our videos at Brandcast Health.